Hello, I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, Conversations at the College, Medicine, Science, and Society. Today I'm speaking with College Fellow Dr. Rhea Powell. Dr. Powell is a board-certified internist, Division of Internal Medicine at the Sidney Kimmel Medical College, Thomas Jefferson University, and Fellow of the College of Physicians of Philadelphia since 2018. You may have read her recent op-ed in the Philadelphia Inquirer on the school district's plan to mitigate the spread of COVID-19 after the holidays. Welcome, Dr. Powell.
Thank you so much. I'm really happy to be here.
So let's get started. This week in Philadelphia, we've seen a relaxing of vaccination requirements for public spaces that serve food and drinks, and introduction of a tiered system of mitigation that signals hope to many that we may be coming out of this latest surge, but also reminds many of us that our experience with COVID-19 may not be over. What are your thoughts on where we are in the pandemic currently?
I would say first that, we've all come a long way. We're not in a place that we were a year ago, and we aren't even in the same place that we were a month ago or 2 months ago. So I think there's good reason for those that have hope. We have many people who have been vaccinated in the city of Philadelphia. Over 90% of people who are 12 and over have had at least one dose of the vaccine, and 75% have been fully vaccinated. Many are boosted, which gives us additional protection. And frankly, because so many people were infected with the last Omicron surge that we're now coming out of, population immunity is also higher. Case rates have been dropping, and the strain on our healthcare systems has been decreasing. So I think as we head into the spring, considering also that there's some seasonality to COVID and warmer weather that allows people to spend more time outdoors, I think we can be optimistic that things are improving. But it's really important also that we remember, the Omicron surge surprised many of us, and that can happen again. And we need to be prepared for the possibility of other variants. We also have to remember that the youngest kids are not yet eligible to be vaccinated, and we have to do our best to continue to lower transmission and case counts. Even with those high vaccination rates in Pennsylvania, the Omicron surge was, actually equally deadly in Pennsylvania across the whole state to the initial 2020 wave in spring of 2020. So here in Philadelphia, we have some of the highest vaccination rates in the state. So outcomes were better during the surge for us. But what happens next, I think, really depends on a few things. It depends on the virus's evolution, but it also depends on our response. And we choose what that response is, the strategies and resources that we use to manage it. And then our response also determines how much we allow the virus to continue to circulate, which then influences that evolution. So what we do next is really important.
Absolutely. You wrote an op-ed in early January when we were really, as you said, deep in the Omicron surge, that the Philadelphia School District's post-holiday Omicron plan isn't good enough. And, obviously we're at a different place now, but we're also in a place where creating a plan is important, both to deal with what we have now, but also what we may have to face in the future. How do you think the Philadelphia schools are handling the pandemic now? And what advice might you give as a physician to other parents who are trying to make some sense out of this?
Well, let me just first say that I think school communities have managed under, tremendous, unprecedented circumstances with, frankly, insufficient resources, inadequate infrastructure, just physical buildings and support, especially here in Philadelphia, where we've suffered from decades of underfunding of our schools. And so as a parent, I've been really blown away by the hard work and persistence and commitment of the school staff and teachers and administrators who have been scrambling to manage, changing guidance and implement new protocols and develop curricula that can be provided remotely, oftentimes with very little notice, while they're trying to do all the things they normally do to educate, students and address the emotional needs of students in a really challenging time. And at the same time, I've also been blown away by the resilience of parents and families and school communities who are, managing all of that uncertainty. So, when I wrote that op-ed, it was in part because, these school communities have been working really hard, and I think they deserve everything we can do to keep our schools safe. That was just after the new year when COVID cases were skyrocketing in the Omicron surge, and it was clear that there was need for better communication and a better plan to manage that surge. We know what works in schools. It's a layered approach using all of the tools in our toolbox. The CDC has good guidance on this. It's The layers include vaccination for students and staff, high quality masks, screening, testing, good ventilation, distancing in classrooms. None of these things are, at this point in 2022, surprises to anybody. So, we really just have to use those tools. And thankfully, we're in a very different place now. And we do have now some policies of using high quality masks in schools, but there's still a lot of room for improvement. Vaccination rates are increasing, but we need to do better. And some of these changes are not overnight. We need better ventilation in schools. We need a robust virtual school plan. We need to also sort of guard against wishful thinking that this is just going to go away. This is something we're going to be dealing with for a very long time.
Yeah, absolutely. To your point about vaccination, the latest data that I've seen, and, it obviously differs depending on where you are, is that about a quarter of school-age children are vaccinated, but the numbers are much, much lower for African-American and Latinx children. What do you tell parents who are hesitant to vaccinate their child against COVID-19? And, how should they think about that?
Yeah, that's a really important question. And I think I'll answer it two ways. I'm going to answer it first with my physician hat on. And I would say, that we know the benefits of vaccination. We know that it's the best thing you can do to reduce the risk of serious illness, hospitalization, and death. And so if a parent or caregiver is feeling hesitant about vaccinating their child, I would really encourage them to talk with their family doctor or pediatrician and share the questions and concerns that you have about the vaccine. I think there are no stupid questions when it comes to your family's health, and there's a lot of misinformation out there. So it's really important to find a trusted healthcare provider who can help talk through those questions and concerns. And then, the other answer I would give is as a parent. So I'll share that my kids were vaccinated. My kids are 7 and 9, and they were vaccinated in November. And then my kids got COVID at the end of December, at the beginning of the Omicron surge. And while, it's incredibly frightening anytime your kids are sick, I was just so relieved knowing that they had been vaccinated. It gave me that reassurance that, yes, they were sick, but in all likelihood, they'd be okay. And thankfully they were. So I want that for every parent and every caregiver.
Yeah. And I think, that's one of the things that we struggle with in terms of understanding the role of the vaccine, that it may not prevent getting an infection, but it will prevent hospitalization and serious side effects, and that's the message. I think that it's sometimes hard to understand, but it's important for people to understand that. One of the things we've learned during COVID with respect to vaccines is that different people, different communities have trusted sources that they go to for information. I'm a pediatrician. Pediatricians always talk about vaccinations with their patients, families, and the kids themselves. We consider ourselves trusted sources for patients and families with vaccines, but it's not always that case, and I think especially with the COVID vaccine, there's been kind of a little nuance to it that people are looking for other trusted sources. Who do you think those are? Do you think the schools have a role in talking about that, or community leaders?
Absolutely. Yeah. No, I mean, I'm an adult doctor, not a child doctor, but I am a primary care doctor. So I'm a little biased to think that I think primary care doctors, whether they're pediatricians, family docs, play a really important role. But you're absolutely right that they're not the only ones that are trusted sources of information. And so it's really important that the message is coming everywhere, that people are going to get guidance about how they should be managing this pandemic. And so I think the schools play a really important role. And the school district of Philadelphia, where my kids are in school, they have co-sponsored vaccine events. They, send messages out about the vaccine to the school communities. So I think that's important. I think, community organizations also can play a role. I know the Department of Public Health has done work on this. So I think it really has to come from all corners so that, wherever someone goes for trusted information about their health, that they're hearing that message about the importance of vaccination.
Great. What's your view, or how do you explain the competing risks between virtual and in-person learning? If there's another surge that comes up, we may end up going back to virtual learning. Doctors weigh benefits and risks all the time. It's just part of what we do when we care for patients, but that's a little harder for others to think about. And especially with regards to their children, schools are considered safe places. I always thought when my kids were young, they were in a safe place. How do you think about competing risks, and what would you tell parents about that?
It's really important. I think there's a lot of discussion about this right now. We know how important in-person school is. We've seen that there's evidence of educational loss over the last couple of years, and we know that schools are not just a place for learning math and writing and reading, which are, essential and important. But they're also places where kids are getting their social support, their emotional support, their, sense of community, getting meals reliably. So schools are really community hubs that are, very important for children. But when there's a novel virus with, high community mortality, the competing risks are really serious. And it's sometimes hard to kind of put all of these things in perspective at the same time. And even though I think, thankfully, the outcomes among kids who are infected with SARS-CoV-2 are better compared to, older individuals. The risk of serious illness is not zero. And I think it's also really important to remember that kids live in families and those families are impacted. There was a study recently from researchers who are based here in Philadelphia, at the University of Pennsylvania and Nemours, and it estimated that over 160,000 children in the United States had lost at least one of their caretakers due to COVID. And also, they found that there were deep inequities in the impact on those families, that those losses were borne disproportionately by children of color. So, we need to take the full range of impact into consideration when we're weighing those competing risks. And at times where there's high community circulation of COVID, like the Omicron surge, we need to be prepared to be able to meet as many of the educational and social and physical needs that kids have in a safe way, which, includes having a plan for a robust virtual option and getting all of the needs that kids have met.
Absolutely. We're in this uncertain time, and we're going to be in an uncertain time, I think, for some time to come. Any final words about advice in terms for school leaders to think about how to prepare parents for what we have now, but also for, what might come? What we heard from the Department of Public Health is this tiered system, which makes sense, but it also will trigger possibly going up the tiers at some point in the future.
Yeah, absolutely. I think, my only final message would just be that I think we need to stop thinking about like the end of the pandemic. It's just how we manage it. We monitor, we intervene, we need to have all of the contingency plans for all of the possible scenarios, whether there's, a period of surge like we just saw recently, where we need to shift quickly, and we need to support our school communities, our, teachers, school staff, parents, families, caregivers in every way that we can. So we're not out of the woods, but I think we've learned a lot, and we've got a lot of tools to be able to keep our community safe.
Great. Well, thank you. Thank you for everything that you do. And thanks so much for taking the time to speak with us today.
Thank you for having me. I really appreciate it.